Hey guys, how are you? Dr. Heather Moore here, owner of Total Performance Physical Therapy. We're going to talk about torn rotator cuff treatments. So before we get into exactly what that entails, I want to talk about the type of tear we're going to talk about. So there are sometimes when you go and you pull your key out of the door, or you go and you reach up for something and you feel a pop and you can't lift your arm. That's an immediate trip to the emergency room. That's not a wait and see. That's a go get it fixed. That's not the type of rotator cuff tear we're talking about. That's a major tear, and those are not the ones that are going to heal more so on their own than not. So if it's something where you can't even move your arm, you can't reach your arm above your head, really go and get some medical attention for that. You should really get a medical attention anyway before you do any of these, just to make sure you're doing the right things. But we're going to go over a few things today that can really help progress the improvement on your torn rotator cuff. Now, a lot of insurance companies are denying MRIs because they want you to come to physical therapy first, because it has been proven to actually help heal a rotator cuff tear. So it is important that you follow through with that medical treatment, because that is the preferred way actually now to treat a rotator cuff. So some of the things that I'm going to show you right now are just very easy. They should be done throughout the day. These aren't like a one and done and kind of check them off. These are things that you want to look at, some of the posture changes you want to make. You want to make sure that all of the other muscles surrounding that torn muscle are staying strong in order to support it. So, and if any of these exercises hurt you, obviously want to discontinue them immediately. It is not a no pain, no gain situation. This is not something we're looking at really irritating the rotator cuff with. You can actually cause the larger tear if you push through it. So the first one we're going to talk about is posture, because that plays a really big part in the healing of the rotator cuff. So if you are someone who is slumped over, or you sit like this, or you have this rounded posture, you're looking on your phone, sitting at a desk, sitting in front of a keyboard, you are at a very high risk for tearing your rotator cuff. And if you already have a tear, it's actually going to just keep sawing it off, and it's going to actually really widen that tear. And it's slowly over time, but it's something that if you continue to sit like this, you're squeezing off the blood supply to the rotator cuff. You're compressing the muscles that are going through that really small hole here. So it can actually exacerbate it and cause that tear to get worse. So all you want to do is roll your shoulders up, back, and drop them down. So here's where you want to be. You don't want to be all the way back like this. Just easy, nice up, back, and drop them down. So you're holding your position like this. Your posture is in good posture with a nice shoulder position, rolling forward or rolling too much back. Actually, there's a little gap there that'll close off and start to pinch the rotator cuff. When you are sleeping, the second thing you want to do is you really want to watch how you're sleeping. You don't want to sleep on your side that is possibly torn, and you don't want to sleep on your stomach. You want to sleep on the opposite side of the arm that's torn, and you want to hug a pillow. So you're more like this. This is actually going to open up that shoulder joint and allow a lot of blood to flow through there, allowing that healing to take place. You can lay on your back and kind of have your arm in front of you a little bit like this. People find that very tough to sleep through the night, but it's not as bad as sleeping on your stomach or sleeping on that actually affected shoulder. When you sleep on the affected shoulder, you wind up actually cutting off a lot of that blood supply to the shoulder. And you want to make sure that you are getting maximal blood flow at night so the most amount of healing can take place. The next thing you want to do is just a simple shoulder squeeze. So you're going to get in that good posture where you just roll up, back, and drop them down. And then you're just going to squeeze your shoulder blades back and relax, and back and relax. This is going to help position that scapula or that shoulder blade in the correct position. If it's not in the correct position, again, it can wind up really irritating and affecting that rotator cuff. The final thing you want to do, and this may not apply to you, but you want to make sure that you keep good range of motion. A lot of times with a torn rotator cuff, you have a lot of pain. You're pretty good here, and then right around here it starts to hurt, and then if you get up overhead, it's less pain. But a lot of people will kind of stop using their arm here because it starts to really hurt. What you want to do is you want to either grab a stick or a pulley, and you want to just move your arm gently through that range of motion. You shouldn't be lifting it like I am. This is not exactly what you want to do. You want to actually use a stick to kind of push it up, or if you had pulleys, you can pull that arm up. But it's really important that you keep that range of motion nice and fluid. A lot of people start to lose range of motion with a rotator cuff tear, and that's going to start a whole other list of problems that we're not going to talk about. So that one's kind of an optional one, because if you have full range of motion already, you know, you can just lift it up and down nice and easy a couple times a day. But if you find that you're not able to get it all the way through the range of motion, you want to take a stick or pulleys and really work that arm. Just maybe 30 repetitions a couple times a day, but making sure you really move through that range of motion, and you're not shrugging your shoulder to lift your arm up, and you're not doing anything weird with your neck in order to lift that shoulder up. You're just going nice and easy, and you're able to lift that arm without shrugging. If you or someone you know is suffering with shoulder pain and wants a free consultation with a doctor of physical therapy, all you have to do is call our office at 215-997-9898, and we'd be happy to get you in. Thanks, and have a good night.